Hello, I'm here to present this article, The Ethical Commitment of Brazilian Social Workers, describes in a scientific production about the pandemic COVID-19. My name is Maria Isabel Barros Bellini. I'm a social worker and professor. I'm teaching the graduate and postgraduate course of social work and Pontifical University Catholic. The presentation discussed the analysis of the bibliography production of Brazilian social work prepared during and about the pandemic COVID-19 in the years 2020 and 2021, published in the Brazilian Journals of Impact of the Profession. This bibliography research took place at the time of deep crisis in Brazil, not only the one outlined the pandemic, but the one that has been inscribed for a long time through a neoliberal policies increases the economic crisis that precedes the pandemic and that gradually and incessantly brutalizes the workers and living conditions of the majority of Brazilian people. Attacks naturally by allowing the exploitation of wood and fire on the protected lands, violates the indigenous populations and the Black populations of population LGBT. The pandemic amplifies the social inequality, sickens Brazil, and fuels hate speech that trivialize suffering, mock debts, naturalize unemployment, and the overexploitation of works. In the articles of social works, the critical and rigorous analysis of reality is identified, as well as indication of possibility in actions developed at work during the pandemic. This action and the possibility was deepening of the work of the professional with a focus on socio-educational actions aimed at the population's access to services and right social mobilization and advice to multidisciplinary teams and services regarding the social benefits available to the populations. Promotions of collective practices of social control, a marked contribution to change in the flow of the access to services and social rights. Scientific production allowed to identify public policies that are most associated with the pandemic and the possibility of COP actions and highlight the neoliberal agenda of the current Brazilian government that abuse the rights historically conquered by workers. The articles point out weakness experienced by Brazilians, especially those most vulnerable by the authoritarian policies of the current Brazilian government, which denies scientific evidence regarding protective measures to prevent coronavirus contagion, X the population to increase the number of cases of infections and deaths by COVID. If actually the scientific producers of the applied social work defends a social policy contrary to the profit needs of capital and based on a commitment to democracy and the satisfaction of human needs. Final reflections of the bibliography research highlight the ethical commitment of Brazilian social work in the struggle for democracy and freedom of to decent job and housing conditions, universal health system, defense of public education, freedom of expression of affections, through articulation with the other professionals categories, strengthening itself and collective with vigor to fight against the atrocities of the current government's policy, thus building conditions to face the Brazilian pandemic and in the face of the setback of protections policy and attack social rights. Finally, it's possible to conclude that the Brazilian social work mobilizes the social agent such a social manager of public policies, non-governmental organization, higher education institution, and agreement with the global people, SUGMA, reinforcing its commitment to a fair society in which social inequality is not naturalized. Thank you very much. Thank you. Muito obrigada.